Welcome back to Rohrich Knows podcast, helping you become a better you. Hi, I'm RodRohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Let's talk about rhinoplasty revision, common questions asked. And these I've compiled over the last couple of months from my staff and my social media. So let's go. So the first one is, I had my rhinoplasty a week ago and I'm very unhappy with the results. When can I schedule a revision? I bet I get this email about 4 times a month. And, you know, I have my staff reply to them and I say, listen, you just had your rhinoplasty. Of course you're swollen. You won't be able to see hardly anything for 6 or 12 months. And I really will not see these patients or do a FaceTime with them for at least 6 or 12 months, preferentially a year, because you won't know what to do. Well, you'll probably know what to do, but it won't have healed and the scar hasn't matured enough. You really need to wait a year to see the final results, unless there's something that's grossly wrong, like an airway problem or a dorsal hump. So, you know, this is what your surgeon should have told you before, that you're gonna have a lot of swelling. It's called the cycle of wound healing. So don't do that. Just find the right surgeon for you, so hopefully you won't need a revision. So here's another one. I'm 6 weeks post-op. When will my swelling goes down? Of course, this I see all the time in my own patients. And they say, well, and of course, this is all covered in the pre-op consult, and of course it's in their informed consent, but at 6 weeks, you're still increasing your swelling way before it starts going down at 3 to 6 months, especially in a primary rhinoplasty. So this is normal. In fact, on the way over here, I just had a text from one of my patients from Colorado. She was 4 weeks out, and she said, my swelling is still there. And I said, well, yes, you live in Colorado, and yeah, you're just early post-op. So this is normal. And what patients need to know is that this is a normal thing. And yes, it'll be swelling, it'll be asymmetric, and it'll go up and down. But if you wear your steri strips and you keep doing it, the gradual slope will be downward and better over time. That's all normal. So, and then sometimes I get this question in revision surgery, and I almost always tell patients I never use rib cartilage, so I never use ear cartilage. So why is there a need for rib cartilage, cadaver or rib cartilage, and not ear grafts when it comes to revision rhinoplasty? And is it safe? Well, I tell patients revision rhinoplasty is like solving a puzzle or trying to put together a puzzle with the pieces missing. And sometimes if the pieces are missing, you have to put them back and find them. And in this case, the pieces I put together and back, I use rib, either your own or cadaver rib. I don't like ear cartilage because it's too convoluted and it's not, I personally think it warps too much and I don't use it. I haven't used it in a decade. So if you need revision surgery, most of the time I will use a rib cartilage because I like it. It's durable, it's straight, and I like fresh frozen rib cartilage even over autologous because I can choose the type I want, the age type I want, and of course they're all safe. So the next one, is there anything I can do to prevent scar tissue from forming from my revision surgery? Well, I think there's a lot of things that we can do together, but innately, 90% of how you heal is your genetics. So when you have revision surgery, our biggest enemy is dead space, and that ability to form scar tissue in the area that you've completely redone the nose. So there are lots of things we do today, from meticulous hemostasis to using all kinds of medications and closing the dead space and really making sure that we get an incredible framework reconstructed to push around the skin envelope. Those are all things that we do, and as a rhinoplasty expert that does revision rhinoplasties every day, these are things that I really pay a lot of attention to minimize the chances for needing another surgery. Because if you can minimize scar tissue formation, that is the key to revision surgery success. But again, it comes down to your genetics in the end of how you heal. So, how can I reduce swelling and how long will the swelling last? Well, there's a lot of things you can do. High protein, low salt, elevation, especially the first 4 to 6 weeks. Sleep with your head elevated. Steri strips help. And many times if you come see me, and you have thick skin or a male or revision, I will do Kenalog into the deep subcutaneous tissue. That's a steroid which will help to break up the scar tissue. These are all things you can do. And then tincture of time. Tincture of time is what helps that the most. And there are some new medications or some new uses of old medications, Accutane, that actually can help with swelling, and if taken over 3 to 6 months, can really minimize the scar formation. And that happens right after surgery, and that has been shown to work. So those are all the things we can do today. But have we completely solved it? No. So is there a limit to the number of revision surgeries that can be done safely? The answer to that is yes. I have done procedures on patients that have had 7 to 11 rhinoplasties, which is almost unheard of. But some patients, when I see them, even if they've had 2 or 3, their scar tissue and their skin envelope is so delicate and so damaged that I can't do anything. So it just depends on how your tissue looks and how many and what type of procedures you've had. So there is a limit, and that's why you really need to know before you go, because if you're going to have a rhinoplasty, try and make sure it's in the hands of an expert. And even in the hands of an expert, you can have a revision. I mean, the revision rate is not insignificant, but at least your chances of it of occurring are drastically diminished. So you don't want to keep having rhinoplasties. I just saw a patient 2 days ago that had 4 rhinoplasties, and she was 6 months after her 4th, and I said, you know, we got to stop. So, and her nose was hard like a rock. And I said, I'll see you in a year and see what we can do, but I don't know if I can do anything, not even fillers, because her skin is so damaged, we're just gonna have to wait. You can massage it, but just know before you go. I'm unhappy with my primary rhinoplasty. Should I return to the same surgeon for revision? The answer to that is, depends. If your rhinoplasty surgeon was a true expert in rhinoplasty, I would say 100% yes, because he or she will know what to do or what not to do and when to do it. But if it's somebody that has done or does 1 or 2 or 3 rhinoplasties or 4 or 5 a year, then probably you should consider getting another opinion. And I mean, it's not uncommon. I see patients along this whole spectrum that have had rhinoplasties done by incredible experts, and actually the result is quite good. And I tell them, you know, you need to go back to your surgeon. And I know that they will do the right thing. But sometimes I see patients that have had rhinoplasties done, and you know, it probably needs, you know, a revision done in the hands of someone that does this a lot. So it just depends. So the key is seek another opinion. You know, we're more than happy to see you, and find somebody that's honest, that's going to give you a good assessment of what you can and what you cannot do. Revision rhinoplasty is challenging. So, you know, what about the healing time? And why is it that the healing time for the final result longer for revision surgery? That's an excellent question, and I have to go through this all the time with my revision patients, because for a primary rhinoplasty, the final result is 12 or 15 months. You can double that every time you have a revision surgery, so it's 2 to 3 years, because there's scar tissue in there, everything is kind of gnarled, the framework can be gnarled with the soft tissue and skin. It can be really challenging. So when you release that, all that framework has to be restored and reshaped, and that just takes a long time to heal. And it's usually double what a primary rhinoplasty is, and that's just a fact of life. So, and this is a question I get not infrequently. I need a revision rhinoplasty, but can I have my old nose back? And they show me their old nose before their first rhinoplasty, and they've had 3. And I say, you know, you just can't do that. You can't ever have your old nose back, even if, you know, you wanted to, because, you know, you've had too much surgery. Even after 1 rhinoplasty, you can't have your old nose back. It's just not possible. You can restore some of the shape and hopefully the function, but you can't get your old nose back. Sometimes you don't want it all back. Sometimes you shouldn't have probably had surgery, but that's a decision that, you know, you've made with your surgeon. So I think that's a good question, but the answer is no. The other thing is, I see asymmetries after my primary rhinoplasty. Can my nostrils be made symmetrical with revision surgery? The answer to that is not entirely. Your nose will never be symmetric, just like our face is asymmetric. My right eye's bigger than my left eye. Your nose will be better, straighter, but will it ever be totally symmetric? The answer to that is no. I mean, your nostrils are never made, they're going to be close, but they're never going to be perfectly symmetrical. And you know, if you look at rhinoplasty patients, you can see that their pre-ops, even in excellent rhinoplasty results, their nostrils are never totally symmetrical. That's just part of who and what we are. So they'll be better, but they'll not be symmetrical. So I would say these are an incredible compendium of really good questions that I get all the time from my rhinoplasty patients and my revision rhinoplasty patients. So my caveat is there's no such thing as a perfect rhinoplasty. Revision rhinoplasty is very challenging. You're never going to have a perfect result. The goal is to get your top 3 goals. Hopefully form and function will be part of that. And be patient with your results. It'll take a couple of years for revision rhinoplasty. And know before you go, choose a select surgeon, that an expert that really will be there with you in your journey. And because it is a long journey, that you have to guide them through the months and years after their rhinoplasty to say, hey, this is what's normal, this is what is not, these are things we can fix, these are things we cannot, and just be patient. And that's why, you know, choosing the right surgeon to guide you is going to be so important. So helping you become a better you and understanding all about revision rhinoplasty, I'm here for you. Give me your thoughts and comments, and until next time.